nanggaling po ito sa matinding pagsubok. Okay? And he could probably have faced mga very impossible odds sa buhay niya. Okay, so yun lang po muna for our ano. So the next time when we see somebody with a very prominent cheeks, probably that must be a person who has good leadership, very powerful, and you have to also look for courage lines, which would mean that this person may have been through a lot. Okay, and hindi ka naman magiging leader kung hindi ka matibay. Okay? Any comments po? Yun lang muna kasi yun po ang forte ni Ma'am Teresita. Oo, kasi parang sa dami ng ating inaaral sa face, mukhang wala tayong matandaan masyado. And, so mas maganda kasi if you could really see an actual face, hindi yung parang diinan mo lang, no? So, and then dahan-dahan po yan. So, for tonight, we're done with the discussion of the cheeks. So, the more malapa, the more prominent the cheeks, the more it can show us the powerful leader po yung patient. Okay? And you have to look for the courage, the so-called courage lines. Okay, so much for that. We will now proceed to our topic for tonight. It's about the crack, the vertical crack in the midline. No, this is also very common. So I felt that there is really a need to go deeper here. Okay, so kung meron tayong red na dila na may vertical crack along the midline at saka nasa center of the middle third. Okay, ibig sabihin nito, I think all of us here are already aware na pag may crack sa gitna, middle third, that is stomach yin deficiency. Especially pag dry ang stomach. So definitely, di ba, pag yin deficiency, may konting heat na siya. So we think of stomach yin deficiency. So the tongue is red and there's a vertical crack along the midline. And when do you diagnose the tongue to have kidney and stomach yin deficiency? Okay, so in addition sa midline crack, yung tongue will appear very red at saka magkakaroon siya ng coating na medyo peeled na or walang coating at all. Okay? So that means pag involved na po yung kidney yin, okay, so you will see a deep red tongue. Okay? So, of course, you will have to, the moment we see a crack, we always think of yin deficiency. Pero pag hindi pa ganun ka-red, no? Or kung nakita natin na parang wala na talagang coating, at saka red na po yung tongue, then we can tell it's a combination of kidney and stomach yin deficiency. So in clinical practice, it says here, the midline crack is often seen in patients, okay, pag ang tongue is pale and swollen. Okay? So, sa totoo lang, this is true, no? Diba? So parang karamihan na nakita nating mga dila na may vertical midline crack is medyo swollen and pale. So if that is the case, yung kanyang pathogenesis is complicated. So ano ba ibig sabihin pag swollen yung tongue? There is accumulation of dampness. So saan ang galing yung dampness? Dahil may spleen qi deficiency. Okay? And usually pag may spleen qi deficiency, mahina din po yung stomach qi. So stomach qi deficiency and spleen qi deficiency often appear together. So pag meron tayong spleen qi deficiency, affected po yung function of transportation. So hindi nata-transport yung fluids, di ba? So there is a lack of transport through the stomach qi. Okay? Kasi between the two, yung stomach kasi yung yang eh. So we expect the stomach chi to be the one bringing this about. So it's basically a partnership between the stomach and the spleen. So the most common symptoms, pag meron pa tayong spleen chi deficiency, alam na natin yan, walang ganang kumain, loose stools, at saka weak yung extremities. Okay? Over the long term, pag hindi natin kinorek yung spleen and stomach chi deficiency, magiging yin deficiency siya. Okay? So, in addition sa mga symptoms of chi deficiency, which we have discussed earlier, magkakaroon din ng yin deficiency symptoms. And what are these? Okay, meron ng epigastric pain, dry mouth and throat, especially in the afternoon. This is very typical of yin deficiency. And there is intense thirst with no desire to drink, but yin deficiency. Okay, so yin deficiency is reflected in the vertical crack along the midline of the tongue. So pag meron tayong nakitang vertical crack along the midline, pero normal yung kulay ng tongue, that means it's pale red or pink, plus normal ang coating, pwede natin siyang hindi pansinin. Okay? Especially kung wala namang symptoms yung pasyente. So you have to really ask, no? Yun. So if the color of the tongue is normal and the coating is normal, then you have to make sure na meron po siyang symptoms. Okay? So what are those symptoms? Yung minensyon natin kanina. So this is frequently witnessed in adults who in puberty or early adulthood, okay, nagkaroon sila ng symptoms of stomach yin deficiency and developing heat, but are currently free of such symptoms kasi nabago na yung lifestyle nila as they grow older. So another interpretation of this tongue sign, okay, pwede rin pale yung tongue mo with a vertical crack along the midline. Pwede rin nating masabing meron siyang stomach chi deficiency. Pero mas common ang spleen chi deficiency. So let's now go to the cases. Okay, so we have here a 37-year-old female who would like to comment on this. Ma'am Betty, would you like to do the honors? So anong napansin niyo sa dila? Malaki siya, di ba?
Opo. Tapos may crack sa center.
Okay. So always remember po na very common po ito. Usually kasi pag sinabi nating may crack, akala natin mainit tapos parang medyo mahaba yung dila. Hindi po yan masyadong common. So here, nakikita natin swollen yung tongue, saka slightly red siya. Okay?
Saka meron siya yung depression doon sa likod.
Okay. Dito.
Saka may yellow coating sa kidney area na.
So slight depression, as you can see here. Saka meron po siyang bagong coating, thin coating in the center. So what could that mean? No? So symptoms niya po, night sweats. So definitely this is yin deficiency.
Yin deficiency.
Yeah, probably kasi sinabi niyo nga may konting na dito sa root of the tongue.
Okay.
So po, kidney yin deficiency and panic attacks. Okay, siguro ito po yung nagko-confirm nun, yung kidney yin deficiency or essence, no? Slight depression Slight depression, baka nag-uumpisa na yung essence deficiency. Severe exhaustion parating pagod no? Okay. Ano sa palagay niyo po yung cause ng panic attacks?
Kidney and deficiency.
Kidney.
Okay. And also the sore back, no? Sore lower back. Very good. So, Western diagnosis, unfortunately, wala. Siguro normal lahat yung laboratories. So, pag hindi okay yung pasyente, minsan frustrated yung pasyente kasi gumastos ng malaki sa test, wala nakita. Binigyan lang ng gamot para mawala yung mga symptoms, no? Binigyan na siguro ng vitamins. Anyway, may background po sa disease niya, severe loss of blood following a traumatic injury. So, ano po ang affected pag may blood loss?
Spleen. Spleen po.
Dali.
Liver?
Spleen. Okay, ito kasi, tingnan nyo ha, meron po siyang traumatic injury sa underside ng leg with subsequent amputation. So, nagkaroon ng naputulan. Dahil nagkaroon ng injury, traumatic injury, then pinutulan. So, ano kaya sa palagay nyo ang nangyari? So, here, kung nakikita nyo, may slight essence deficiency. No? Kasi po, medyo nag-depress na po. Yeah. And also, meron po siyang slight kidney deficiency with accumulation of dampness. Yung nakikita ninyong
yung ano sa dulo.
Okay. Yes. This is yellow, di ba? Tapos, stomach deficiency onset pa
Because
lang.
of the line. Crack.
At saka merong regeneration of stomach and spleen and stomach chi. Okay, kasi mayroong nagpo-form na bagong coating. Okay, so ang nangyayari kasi pag nagkaroon ka ng severe blood loss, affected po talaga ang spleen chi, di ba? Okay, punta naman tayo sa next case. 43-year-old female. Ma'am Teresita, do you want to comment?
Pale red tongue. Pale. Pale. Ang color of pale. And then, my teeth marks. Then, parang thin man siya. Thin ba? Then, my midline crack with an old yellow coating sa root. Doon sa root.
Nandoon po siya sa may vertical crack.
May
yung
vertical.
Yellow greasy coating, no? Or yellow greasy fur. Diba? So parang meron tayong napag-aralan yan last time, no? What it means. We'll find out later. Okay. Ano sa palagay niyo ang reason bakit siya nagkaroon ng frequent mucoid stools with undigested food?
So probably my spleen chi deficiency siya, Doc.
Okay. Mucoid stools, undigested food.
Appetite, fatigue.
Tenesmus. Ano ba po yung tenesmus?
Stomach. Pati may stomach chi deficiency din siya, Doc, kasi may no appetite siya and fatigue ang symptoms niya. And then may flatulence.
Ano po ibig sabihin ng tenesmus?
Sir, may I answer? Too much effort. Too much effort about nothing.
Yes. You feel like you wanted to move but there's nothing. Yeah. Okay, nandito na. Oh, wow, very complete. Cramping, rectal pain, kinakawala. Thank you, Doc, for the answer. Cramping rectal pain that makes you feel that you need to have a bowel movement, even if you already had one. Okay. Yeah. So what do you think is the problem here based on Chinese? Like when you talk about tenesmus, Ma'am Roxanne. What in the tongue can make you associate the problem here? Sabi nga ni Ma'am, okay, tinan niyo po, teeth marks.
Kasi pale ang tongue niya at saka may teeth marks. And then, May stomach deficiency din siya because of the symptoms na may flatulence siya at no appetite. Ano ba
Weight
yun?
loss.
Weight
Yeah, no
loss.
appetite, spleen is spleen. Okay, let's take a look.
May spleen chi deficiency siya at stomach chi deficiency.
Actually, yung tenesmus niya is a classic sign of ulcerative colitis. Do you remember? So, yeah. There's accumulation of damp heat, yes. Correct si Ma'am Roxanne. Okay. Ulcerative colitis for 10 years. Allergic rhinitis. Okay. Ano po ang connection nito? Like, bakit po nagkaroon siya ng ulcerative colitis and rhinitis? Does it follow? Sa Western kasi, they might find that these are two separate problems. Okay. Ano sa palagay niyo, Ma'am Betty? I-connect ba yung dalawa?
Dahil po yun sa lungs and kidney.
Lungs and
Kidney.
Ulcerative colitis. Dahil po yan sa
lungs and large intestine.
Yung allergic. Akala ko allergic na rhinitis.
Allergic rhinitis sa ilong. Allergic rhinitis. So background to disease, long-standing emotional problems. So affected po talaga yung kanyang corporeal soul, lang na lang, di ba? Yan. So spleen chi deficiency with accumulation of dampness. Okay, bakit? Kasi meron na po siyang, malaki na po yung pang niya, pale. So may teeth marks. At saka meron din siyang stomach deficiency dahil po sa crack, no? Saka may damp heat.
So yun ang posibleng reason bakit may ulcerative colitis po siya do. Dahil sa stomach deficiency with accumulated damp heat.
Yeah, oo. Kasi pag may problem ka with the stomach, it also affects your large intestine or the colon. Kung nakikita nyo, kung naalala nyo po, andito po sa posterior third ang large intestine, di ba? And then, connected yung large intestine or yung colon sa lungs. So I think walang nakikita tayo dito na may rhinitis. Mukhang sa tingin ko naman walang kinalaman itong crack dito. Kasi ang nakapaglala lang yata is this one, the emotional problems. Yes. So, yun. Pwede ka naman i-diagnose may allergic rhinitis based on your symptoms. But sa TCM, there is really no physical thing here na may nakita tayo, di ba? Kahit yung sa lung area po ng tongue, wala naman tayo nakita, di ba? But because of this long-standing emotional problems, may impact po sa kanyang lungs. And this can affect karamihan kasi na may ulcerative colitis, meron talagang emotional component. And at saka napansin ko rin, no, yung mga may problema sa ganito, no, gastrointestinal, usually may problema rin sa kanyang lungs, kanyang respiratory, no? Okay, so how do you think can we resolve the emotional problem? Yun yung ating i-take up sa ating discussion sa depression. So I think we need to really do something about the what's this? Okay, dito po, tingnan nyo, flatulence, okay, weight loss, no appetite, fatigue, tenesmus, eating disorder. Thank you, Ma'am Roxanne. Frequent, you can have eating disorder if you have emotional issues. Okay? So kita nyo talaga, no? I also read somewhere, titingnan mo yung contour ng kung medyo pabilog na po siya. So medyo affected na siya sa emotions niya. Okay? At saka, ano pa? And the lungs definitely will affect also, okay, because of the emotional problems, so wala siyang ganang kumain, definitely, naapektuhan yung spleen, no? Kasi di ba, lung and spleen, they are like mother and son, right? And because of this, the spleen was affected, um, you will have dampness, okay? So no appetite, so weight loss, no pa, tenesmus because of the ulcerative colitis, and frequent mucoid stools with undigested food. Okay?
That is the spleen deficiency. Affected
Yeah.
ng spleen, Doc.
Yes, very good. Okay. So itong nakita nating ito, dahil po ito sa damp heat, no? Okay. Okay, let's take a look at another, kasi mukhang wala po tayong ngayon yata. Meron ka yung pinadalang picture, Ma'am Roxanne? Wala. Okay. Okay, wala pa. Sige, we will continue with another, ano pa rin siya, ano ba to? Vertical midline crack, part 2. These are actually old lectures, di ba? So, it's always good to go back. Okay, let's continue. Okay, tuloy po natin. This time, meron tayong case. Punta na tayo sa part 2. Mahina ang signal ngayon. Okay. Okay, ito yung tongue kanina, no? Case history, yung may ulcerative colitis. So Mrs. F fell ill with ulcerative colitis at the time of great upheaval in her personal life. She was successfully treated with conventional medicine, symptom-free for 8 years. Again, her stools became soft and mucoid. The tenesmus was very painful. This was accompanied by lack of appetite, weight loss, and a feeling of extreme fatigue. So yung vertical crack niya along the midline was deep, and meron po siyang greasy yellow coating. And correct si Ma'am Teresita, di ba? The body, tongue body was pale. The pulse was deficient and rapid. So rapid because of the yin deficiency, empty heat, and the stagnation, okay, collection of fluids and dampness produce the abdominal pain and tenesmus. Okay. Okay, so yung greasy yellow tongue coating plus the deep vertical crack indicated the presence of dampness and developing heat reflected in the rapid pulse. So the heat manifested in the imperative urge to defecate. Okay. Dahil sa heat na nag-develop because of the yin deficiency, yun na yun. So accumulation of dampness due to the underlying spleen deficiency was the dominant pathological factor because the spleen was unable to adequately transform or transport. The patient suffered from weight loss, fatigue, and loss of appetite. So kahit merong spleen chi deficiency ang pasyente, may nakikita tayong vertical crack. So that means meron siyang simultaneous heat in the body. So yung vertical crack along the midline points to severe stomach chi deficiency kasi po malalim na saka meron na po siyang coating, no? Meron ng damp greasy coating. The conspicuous depth of the crack warns of developing stomach yin deficiency. which can occur as a consequence of long-standing diarrhea and smoldering heat. So red tongues with deep vertical cracks in their center indicate stomachache deficiency and developing inferior heat. Okay. So hindi na so kahit pala pale pa yung tongue body, nagde-develop pa lang yung kasi po ang problem niya nandito pa lang talaga naka-concentrate sa stomachache deficiency. Nagde-develop pa yung init. And this is the one that's causing the abdominal pain, the tenesmus. In a pale tongue, such a crack may suggest an old healed injury to the stomachache. It can also denote weakness of spleen and stomach, chi, with the possible development of stomachache deficiency. Okay, punta na po tayo sa 54-year-old female. Sinong gustong mag-analyze? Ma'am Unstoppable. Okay. Kung napansin nyo, wala pa tayong nakitang tongue na medyo narrow, no? So, totoo talaga yung sinabi kanina sa clinic, it's very common to see swollen tongues na may crack sa gitna. Okay? So here, kung nakikita nyo, deep po yung vertical crack niya. So, ibig sabihin, stomachache deficiency nagde-develop na ng heat. Okay? So, rootless. So, ibig sabihin, wala na po itong dito sa likod. Heel coating, depression at the root of the tongue. So, this could probably explain the severe exhaustion, di ba, Ma'am Becky?
Opo.
Meron na po siyang essence deficiency. Heartburn. Ano kaya ang cause po ng heartburn? So pag heartburn,
doon na sa dulo.
po siyang fire, di ba?
May heart fire na siya.
Saka yung crack hanggang sa heart.
Pero okay, let's see. Epigastric distension. Yeah, heart crack. Okay. Feeling cold. See? Swollen knee and metatarsal joints. Oh, this is also very okay. When you talk about
Yung deficiency din siya, Doc.
si kidneys na yan, di ba?
Oh, yes.
Oh, Western diagnosis, rheumatoid arthritis. Oh, di ba?
Bongga.
May onset of kidney essence.
Yeah, rheumatoid arthritis. Okay, ang tagal mag-change nito. Yeah, rheumatoid arthritis. Napakahina pala ng internet. Okay, so
Ulan po.
ang background to disease niya, diet of exclusively raw, uncooked food. At saka overuse of anti-inflammatory drugs. I'm sure gumamit siya ng gamot para sa knee pain niya, no? And okay. Ito pa lang nangyayari. Okay.
Exclusively raw, uncooked. Masira ang kidney.
Yes. So, ano po ang how will eating raw uncooked food bring about stomachache deficiency? Anyone? So, ibig sabihin niyo, pag
stomach gusto ng hot.
Hindi.
Parang hot pot.
Siguro po, ano na kasi, pag sinasabi dito, exclusively raw. So, ibig sabihin, wala siyang ibang kinakain kundi hilaw na pagkain. And hilaw na pagkain, meron po siyang cold energy.
Cold.
So, ibig sabihin, kalaban siya ng spleen. So, I think what happened here first was nagkaroon siya ng spleen chi or spleen yang deficiency. Then naapektuhan. So, ibig sabihin, hindi gumagalaw yung food. So, nagkaroon ng retention. What else? And so, kaya nagkaroon ng stomachache deficiency. Yun ba yun? And also, dahil po sa mga gamot niya, no? Nagkaroon siya ng kidney deficiency and essence deficiency. O tingnan nyo, parang meron na talagang V, oh. No?
Tapos
Malalim.
parang ang daming no, parang yung yung sa coats niya dyan sa kidney area.
So kung naalala nyo, no, ano ba to? Yung tatlong etiologic factor at tatlong pathogenic factors sa rheumatoid arthritis, wind, cold, dampness. No? So yun. And yung I think ang nag-cause ng stomach deficiency, nakakasira talaga sa stomach ang pain reliever. No? Yun na yun. Okay, punta naman tayo sa 32-year-old male. O tingnan nyo, malaki pa rin yung dila, di ba? Parating malaki. So, sanayin na natin yung ating mata sa mga ganitong cases. Ma'am Roxanne, would you like to analyze using the description here? Is it well? Mm. 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 Dump heat. Definitely may dump heat. Smelly socks too. Some may. Mm. May nakikita kang crack, di ba? Kasi ganito yan, tignan mo, yellow greasy coating. So ibig sabihin, dito pa lang nakikita natin may heat siya. So definitely meron siyang damp heat. Diba? Oh. Okay. Ito na yung sinasabi kong may disconnect sa kidney at saka sa heart. Kung titingnan nyo, dapat kasi ito hindi masyadong mapula. Samantalang ito, hindi din ito hot. Kasi supposedly water element, ito yung mag-offset ng heat galing sa heart. Diba? So in this case, kung nakikita nyo, pula din yung tip and the edges, no? Diba? Pulang-pula yan. And then, even the tongue itself is already reddish, right? So there's too much heat. So, pag may disharmony between the heart and the kidneys, magkakaroon talaga ng inner restlessness, panic attacks. Okay. What about the feeling? Yeah. What about the feeling of fullness after eating? This is very common.
Spin deficiency.
Okay, let's take a look. Okay. Brilliant. Ito po yung kanyang diagnosis sa Western. Protruding disc between the fourth and fifth lumbar vertebrae. So this is the kidney area, di ba? Ano? Lower lumbar.
Accumulation of
Fourth and fifth lumbar. Kidney, di ba? Background. Protruding disc. So talagang magkakaroon talaga ng pain. O back pain with numb feeling in the left leg. Okay? Saka meron siyang alcohol abuse, irregular eating habits, suppressed emotions na nag-generate ng heat sa sides, too much sleeping. So there's dampness. So yung diagnosis niya, accumulation of damp in the liver and the gallbladder, stomach deficiency with accumulation of phlegm. Kasi
because fullness na nga daw.
Kumusta?
ito na yung fullness. Ito na yung fullness after eating, maraming phlegm.
Stomach deficiency with accumulation of the phlegm heat.
Yeah, phlegm heat. Phlegm heat kasi kung nakikita nyo, kinover na niya to, oh. Diba? Yeah, stomach fullness, yeah. Stomach deficiency with accumulation of phlegm heat. Okay. Accumulation of damp heat in the lower burner. Next, 52-year-old female. Oh, pangit ang tongue niya, di ba? O Ma'am Becky, sa inyo na to. Last na ba to?
Pangit ang binigay sa akin.
Actually, dapat masanay kayo sa pangit. Baka mayroon tayong mamakuta ganyan.
Nakakatakot ang itsura
Main.
mo.
Deep, vertical crack siya. Tapos
Very
wala ng root na napil na yung coating.
Saka,
May, ayun sa tip. Ano ba yun sa tip? Peeled na rin.
Bakit may parang dots na white? Sa picture lang yun?
mga waxy na coating.
Okay. Na-peel.
Parang may liver yang rising siya, Doc.
Mm.
Because of inner restlessness and feeling of pressure in the head.
Pressure in the head.
Siyang cold hands.
Then kidney
Yang deficiency.
because of the peeled coating.
Pale ang coating Pale ang tongue.
Kaya
Pero,
cold.
ubus na yung kanyang mga coating. Feeling of pressure in the head. So may phlegm na yan. Diba? Inner restlessness.
Maraming phlegm.
May dampness. And blood deficiency. Okay, walang Western diagnosis. Imagine ganyan yung dila, di ba? So background
Sayang ang pera.
overwork, menopause.
Oh.
52, okay. Spleen sheet.
Energy deficiency with accumulation of dampness and blood deficiency.
Blood deficiency siya kasi pale ang dila. Sa
Okay.
kamay
Umikin. Sakra.
see yellow coating.
Kidney.
Kasi pale ang dila, di ba? May blood deficiency.
Accumulation of dampness kasi may yellow greasy coating.
Stomach, kidney, artery deficiency. Tama si Ma'am Betty from the dual end to end. Okay? Kasi nawaksi na yung coating dito Okay. Nakaka-stress yung mga dila. So maraming salamat. Ang dami yata. Okay. So thank you very much sa mga nag-participate kay Dr. Gabino.
Maraming salamat po.
Thank you po.
Share off topic.
Thank you po, Doc.
Sige po, Doc.
Dr. Heck,
Yes.
off topic lang. Madalas kami magtalo ni Betty. Lagi kami nag-uusap niyan Sinasabi niya, pagka daw acute, Masakit na masakit. Pagka masakit na acute na yan, sinasabi niyang ganun. Sabi ko, hindi, mali ka. Kasi pag sinabing acute, it refers to the onset of the disease. It does not refer to the intensity of the pain. Tama po ba ako o mali siya?
Opo, acute onset.
No ka, humanap ka kakampi
Humanap ng kakampi. Hanap ka rin, Ma'am Betty, ng kakampi mo.
Oo nga.
Para patas.
Madalas ko po kasi marinig sa kanya yun eh. Kapag sinabi niya, pagka ang illness eh, sandali lang, acute yan. Madaling matapos.
Wala pang month, walang 6. Yeah. So, yung basis kasi niyan, sudden onset, yung acute.
Hindi po yung intensity ng pain.
Yes, it refers to the onset. It actually refers to the onset. So, okay, maraming salamat po. Yon, sige.
Thank you.
Maraming salamat, marami tayong natutunan. Hopefully, parting words, Miss Unstoppable, kumusta na yung mother niyo po?
Sa awa ng Diyos, Doc, kanina pagising ko, tulog pa ang lahat. Kapit pala ako, pagkagising ko, nashock ako. Siya na yung nagluluto, tapos naligo na siya. Well, yung mga symptoms niya, yung sinisikmura, yung hingal niya, wala na daw.
Why, thank you.
Kumbaga, sabi ko, di ba, we are so blessed talaga na and we have learned a lot from you. Ginaguide tayo kung ano yung dapat ipainom, ano yung dapat gagawin, ano yung dapat tirahin sa mga points. Kaya, I'm very thankful po sa inyo.
No,
Always.
we're learning together. We're not learning from me, we're studying together.
Kaya nga, you inspired us to do that.
Yeah, kasi naman ako lang mag-isa, di ba? So dapat mag-hirap din lahat.
Parang group study lang.
Kasi si Dr. Gabino, hindi na
Ayun,
nag-a-access.
may additional doctor na tayo.
Okay.
Thank you, Dr. Gabino, for joining us.
Doc Hec, Doc Romy, thank you.
Maraming salamat din po.
Now
Pag sinabing acute, bigla ang dating. Does not refer to the intensity of the pain.
Yeah.
Ikaw, Doc,
Ito kasi sinasabi
Sabi mo,
acute
cute ako.
Acute na.
Dapat
Sabi, cute ako ngayon. Acute na ako, Sige. Yo. Matulog na tayo.
Goodbye na.
Thank you very much.
Thank you.
It was very
Ingat.
beautiful.
Lahat.
Hello to good morning to Miss Gretel.
Good morning.
Good evening sa inyong lahat dyan.
Ma'am Roxanne, Ma'am Teresita, Ma'am Betty, thank you so much for sharing
Thank you
your
po.
knowledge. Absinot ako kasi sa class natin eh. I'm learning from here.
Sige, konting effort lang. Marami pa. Maraming salamat po. Good night, everyone.
Good night,
Good
everyone.
night.
Thank you, Doc.
Kayo
Thank you sa lahat.